Hi everybody, this is Dr. Anugraha here. Hope all of you are doing good. Hope all of you are happy and healthy. So let's start with Apgar score. So it's a very important question that usually comes in every alternative papers of your final year pediatric topic. It comes as a 2-mark or a 3-mark question. So tell me, on whom do we check the Apgar score? On whom do we check it? On newborns. And why do we do it? See, it is to find the well-being of a newborn. So basically Apgar score, it is a clinical assessment that tells you about the well-being of a newborn. It tells you if the newborn has got any sort of asphyxia. What is asphyxia, guys? That is, if the baby is not able to take in enough of oxygen, that condition is called as asphyxia. And why are we worried about asphyxia? Because asphyxia can cause potential brain damage. So immediate interventions have to be done, right? Now this Apgar score, you know who invented this? It was invented by an American anesthesiologist whose name was Virginia Apgar in 1952. Okay, so this Apgar itself is a mnemonic for Apgar score. A stands for, first I'll read out the components and then I'll explain. So A stands for appearance of the baby. So you see the color of the baby, if the baby is blue, if the baby is pink, and then you give the score. P stands for pulse rate of the baby. G is for grimace. What is grimace, guys? A grimace means that reflects irritability, reflects reaction that is shown by the baby. You irritate the baby, you tap the soles, or you suction the nose using a nasogastric tube. So basically you irritate the baby, and normally the baby should be irritated. It should show some irritated facial expression like this. Or when you're putting a catheter into the mouth, that is a oropharyngeal catheter, or when you're irritating the baby using a nasogastric tube, the baby should cough or sneeze because it should get irritated, and that is normal. But if there is no response, then it means that the reflex reactivity is low, right? Okay, so grimace you understood. Next is A. A stands for activity of the baby. Activity matlab kya hai? Muscle tone of the baby. Alright, and R stands for respiratory effort. See, R is not respiratory rate. It is a respiratory effort shown by the baby. Now let's study one by one. See, it's very simple. Okay, appearance. Let's start with appearance. If the baby is looking blue or pale completely, the entire body is looking pale or cyanosed, you will give a score of 0. Okay, see, which all scores can you give in Apgar? You can give either a score of 0 or a score of 1 or a score of 2. Okay, so 0 means the condition of the baby is not good, right? 1 means it is moderate health, and 2 means you should be happy. That means the baby is in good health. Okay, now if the appearance of the baby is blue or pale, you will give a score of 0. Simple. If the peripheries are blue and the body is pink, you will give a score of 1. If the baby is completely pink, you will give a score of 2. Now let me show the picture. Okay, just see the first box here. Appearance. If the baby is completely blue, you will give a score of 0. If the extremities are blue, see. Look here, if the hands, see this part, legs. If the extremities are blue but the body is pink, then you will give a score of 1. Okay, and if the baby is completely pink, you will give a score of 2. Easy? Fine. Now the pulse rate. See, if the pulse rate is absent, or if the pulse rate is less than 60, you will give a score of 0. It's bad. If the pulse rate is less than 100, you will give a score of 1. If the pulse rate is more than 100, then yeah, it is good. You'll give a score of 2. Easy. Next is grimace. Again, I told you, see, grimace means what? You see the irritation shown by the baby. You irritate the baby. You tap the sole or put a catheter and see if the baby is showing some irritation. Catheter onto the mouth or the nose. So if there is no response, it means that the baby's reflex is not that great. So it means there is no response, and you give a score of 0. If the baby is showing some facial irritation, that's called grimace, then you will give a score of 1. right? If the baby is coughing or sneezing, then it is a good reflex. Then you will give a score of 2. Now, A stands for activity of the baby. Activity matlab kya hai? Muscle tone of the baby. If there is limp matlab what? If the baby's muscles are not firm, okay, if they are floppy, that means if there is some weakness in the muscle, then you will give a score of 0, right? If there is some flexion of the limbs, then you will give a score of 1. If the baby is showing active movements, then you will give a score of 2. Easy? Now R is for respiratory effort. Repeat after me. R is what? Respiratory effort, not respiratory rate. Okay. So you see if the baby is showing some respiratory effort. So see, when the baby is crying, obviously air will get into the body, right? So that's how we assess if the baby is having a good respiratory effort or not. So if there is no respiratory, if the respiratory efforts are absent, you will give a score of 0, right? If there is a weak cry, you will give a score of 1. If there is good strong cry, means it is breathing very well. So you will give a score of 2. Okay. Now, guys, tell me, what is the maximum score a baby can get? See, there are 5 components, right? And for each component, the maximum score that you can give is 2. So totally, the maximum score that when you add up all the 5 components, the maximum score that you can get is 10. Alright? Now see, when you add up all the scores you got in these 5 signs, if you get 0 to 3, then it means the condition of the baby is bad. That is severe birth asphyxia. Severe birth asphyxia. If the score is 4 to 7, then it means there is moderate birth asphyxia. Moderate. If it is more than 7, that is basically 8 to 10, then yeah, the baby is normal. Alright. Now, when all do we check the Apgar score? What is the time? See, we check the Apgar score at 1 minute. We check it at 1 minute of birth and at 5 minutes of birth. What is it? We check the Apgar score at 1 minute of birth and 5 minutes of birth. Now, if you get less than 7, if you get the score as less than 7 at these 2 times, then what you do is you continue checking the Apgar score every 5 minutes. Okay, every 5 minutes until 20 minutes. Until 20 minutes, and you check it and check if the Apgar score is improving. If it is improving, well and good. Otherwise, interventions have to be done to treat the baby. Now see, what are the conditions where the baby's Apgar score could be low? Tell me, what are the conditions? Basically, what are the conditions that can cause asphyxia in a baby? It could be hyaline membrane disease where the lungs are underdeveloped. It could be meconium aspiration syndrome. So these are the few conditions where there could be low Apgar score. So I think okay, that's all about Apgar score, guys. I wrote a poem. Yeah, this is my poem. I like writing. I like writing poems. I like writing short stories. Of course, I would like to write a novel, but then we don't have time. So yeah, let's call it a day, guys. If you have time, go through my poem and let me know the feedback about the poem as well as about my class. So I'll see you in the next class. Stay fit, stay healthy, drink lots of water and stay blessed. Bye-bye.